Hey everybody, check out this massive root canal infection that affected my all-on-4 surgery and what we were able to do about it. And also, if you wanted to look behind the scenes of what actually happens during an all-on-4 surgery and take a look inside the patient's mouth, then we got a really cool video here waiting for you. But if you are a little squeamish, I might recommend you not watch that part of the video, but don't worry, I'll give you a heads up in regards to when we are going to actually show you that stuff. Okay? All right. Hey, everybody. My name is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center. I'm a board-certified periodontist. Have placed over 10,000 implants in my 12-year career, and wanted to show you, we do lots of all-on-4. See a lot of cool, crazy stuff. And unfortunately, we get so busy sometimes. I literally have these ideas of things I want to show you guys, but I literally don't have the time. But hey, today's a day off. It's January 2nd. Before we go back to work and see a few more all-on-4 cases this week, I want to show you what we saw last week. All right, so here we go. Here's our patient. He's a male in his early 40s, and you can see he's got a lot of bone loss going on, black triangles. His teeth are moving, a lot of cavities in his mouth too. And his chief complaint is he knew that he had periodontal disease, and it was basically a losing battle. Obviously, he wasn't happy about his aesthetics. And here's his x-ray. You see a lot of bacteria, tartar, calculus underneath his gums. You see these little projections hanging off the roots of his teeth, and a lot of bone loss going on. And so, long story short, he knew the writing was on the wall, and he wanted to get a solution that made sense, wasn't wasting time, was cost effective. So he did his research, found all-on-4, then found us. So, this looks like a pretty easy case when you look at it. His sinuses, not too pneumatized, plenty of bone still left, even though he has periodontal disease, until I took a closer look. All right, so here's his 3D scan, and wait a second, what do I see here? There is a huge infection. So he does have a root canal tooth. Is it uncommon to see something like that? Absolutely not. He actually has a periapical cyst from his failed root canal, and what we're seeing right now, let's take a look at the opposite side, right? So he's got a root canal on this side, no infection there. What we're looking at is the outer cheek. We're looking at the roof of the mouth, sinus, nasal cavities, and then down here, lower tooth. And then let's see right here. He's got plenty of good bone around this root. This is his root. This is the bone. This is what we want to see. We want to see the white bone. Let's take a look at the adjacent teeth. Same thing. Roots. And then you got the bone. Again, this is the outer lip, nose, roof of the mouth. Okay? So we're looking at him from the side. So we go here. Same thing. Go over here. And then, whoa, wait a second. What's all that dark? Go from here. Oh, what's all this, right? So this is basically the beginning of the infection. So all the bone that used to be there for the other side, now that's all gone, eaten away by the infection. All right, so see all that bone loss. And what was the culprit? It was this tooth. This tooth with the failed root canal is what created that huge chronic infection. And this patient then resulted in a large cyst. And what that cyst does is it destroys all the bone that was there. So that's basically what happened with this patient. Well, why is that an issue? Well, when we're placing all-on-4 dental implants, what we want to do is we want to place at least 4 implants. And what we want to do is we want to spread them equidistantly apart. So we want to get enough supports where we're going to be chewing, right? So we want supports up in the front, we want supports in the back, we want the supports back enough that when I'm chewing with my molars right here, right? So if I got some molars back here and I'm chewing back there, then what I want to make sure that if I'm biting back there, that we have, that's going to be taking a lot of force. We want to have a dental implant underneath there. So we need to have our implant spread apart nice and wide enough. So here in Dallas, there's a big highway overpass out there. They want to make sure that their pillars of support are equidistant from each other. You don't want to have a point of weakness because the pillars of support are too spread apart from each other. Because if they have max load, they have max payload from all these semi-trucks, 4 semi-trucks all crossing at the same time, suddenly the bridge doesn't fall through, right? And the same thing actually goes with the dental implants. Again, with an all-on-4, we want to spread those implants equidistantly. Now, the issue with him is that where we wanted to place those implants, you could see that from this whole area, basically, which is right between his first and second premolar, all the way to basically his front central incisor on the right side, tooth number 8, that's all infection. And we want to definitely stick an implant there. And so that's going to pose a little bit of a problem. So what we were able to do is we actually end up placing 7 implants on him up top. And what people need to understand is, again, they call it all-on-4 because assuming you have a nice good amount of bone, you get a nice good spread of your implants, all you need is 4 implants. having more implants offers us greater redundancy, meaning I technically can get away with 4 implants for a table, but if I have 8 legs on a square table, then maybe I have a little bit of redundancy that if I kick out a leg, I'm still good to go. And the same concept goes with this. So our patient here was saying, hey, I want at least 6 implants. Can you give me redundancy? And I said we could definitely do that for you. But in fact, turned out that he needed 7 implants because of what was going on. Now, do I want to place a dental implant in a previous root canal infection site? No, I hate it because root canal infected sites are one of the biggest issues with dental implants. And I made another video, and I'm going to link it above that you could check out. In this week, talk a lot about basically bone grafting, placing dental implants, and also what sites may be good sites and what sites may not be good sites. So after placing implants for 3 years of residency and also placing implants for another 12 years of private practice, one thing I definitely learned is that infected root canal sites are not the most ideal place to place implants. And if you do, you definitely want to, clean them out real well, do a bone graft, and then wait, probably 6-7 months before you place that implant, making sure that the bone isn't as toxic there anymore. So now here's the cool stuff, right? So when you look at that 3D scan, you say, all right, so where would I place my dental implant? So let's do that real quick. So what I did here real quick was I basically acted like I was placing some dental implants. So I placed a dental implant here in the upper left, and this was what it'd like being engaged in the bone. And then as I scroll across, here we go. We have another implant on the upper left area, and this is what it would look like in the bone. But look at that area that has infection. There's no bone there. All you see is that black, right? So the only bone that exists is right here at the floor of the nose, right? So, I mean, there's no bone right there. So what am I going to do? Where am I going to place an implant? Well, unfortunately, there's just so much bone loss that I wouldn't be able to place an implant. So what we actually did was we placed 7 implants. We placed 2 pterygoids and placed, honestly, I don't even remember. I have them in my notes here, but we placed 7 implants on him, but we had to basically avoid this whole area because it was so infected. So we placed an implant right over here, and then we placed another implant right over here. Is that spread a little bit more than we'd like? But yes, but with the advancements in materials today, like we're going to be fine. But still, definitely, ideally, not what we want to see. What's the moral of the story? I mean, if you have an infection, so many times I hear patients that say, I'm going to wait for my tooth to fall out, or I'm going to wait for this periodontal disease to keep destroying my bone. At a certain point, it's the all-on-4 procedure is very forgiving that we can deal with a lot of bone loss, but at a certain point, it becomes so detrimental to hold off on your procedure, whether it was gum disease, periodontal disease, or it is root canal infections like this that cause so much bone loss. So don't sit on this forever. Now, if you're adventurous and you want to actually see something cool in regards to the actual surgery, I actually have video when we go in, when we pull the gums apart, when we go in and we clean out that infection, we actually see the cyst and how we remove it and what the bone looks like afterwards. If you want to check that out, please stay tuned. I'm about to play it. If not, no hurt feelings. Definitely. If you guys have any questions, please feel free to leave a comment below. If you're still watching, all right, here we go. So here he is after he's had all his teeth extracted. And I turn the volume off here. What I'm doing is I'm now separating the gums from the bone. And you can see right there, you see each individual tooth socket, right? All right, so here we go. Now I'm separating the gums, pushing in that, check that out. Pushing in that area. Oh, yep, got some pus coming out. All right, that's purulent exudate. All right, so as we keep flapping, separating the gums, right? That's what we gotta do for every all-on-4 procedure. All right, so what ends up happening here? Now, because so much of that structure was undermined due to that huge infection and that bone loss, what you're gonna start to see are that bone starting to crack off, because with all this pressure and all that undermining of the bone, you're gonna start seeing the fracturing. So the bone is literally gonna start breaking off. All right, here we go. Let's see. Yep, I think there we go. There you go. You start seeing it fracture off, right? Because once it's been undermined that much, it's going to start fracturing off. And now you see that that's gotten loose. So we just have to remove that bone. All right. And you're going to see that part fracture off too. There you go. You see it loose. Yep, we're going to lose that bone too. We might as well remove it because we're not going to be able to place an implant in the area. So here we go. Now I'm trying to separate the cyst from the bone. And you're going to see me mess around with that quite a bit. All right, and it's starting to loosen up, loosen up, loosen up. Let's go a little faster. All right. And there we go. We see the cyst still adhering to the gums there. And we're going to separate that. I'm going to cut that off. There you go. You can see it real quick before I cut it off. And I'm going to fast forward here. All right. I wanted to fast forward so we don't catch his face. All right. Here we go. So what is left? We got a huge cavern here, right? All right. Let's take a look here. So we have nice sockets here where we could just drill right into and place an implant. We couldn't even use this socket because right underneath here it had there's a bunch of bone loss. This is completely just basically undermined. So I actually did try to place an implant in this area, and this bone just completely crumbled. So I actually placed another implant like right over here and another one right over here, and then the other one right over here. So we had to skip this whole area because that infection completely destroyed this wall of bone and also just kind of ate away all this bone underneath. So that's basically just made the process extremely complicated. And what I did was I just completely bone grafted this area to just kind of like fortify the area and added some membrane in that area too. So you could see kind of like how everything is undermined there. So hopefully this wasn't too gross for you, but hopefully this information was helpful for you guys. Again, long story short, do not wait if you have an active infection, periodontal disease. Don't wait forever. Patients seem to sit there and wait and say, I can do this later, just wait for my teeth to fall out. That doesn't help anybody. It doesn't help us, doesn't help you, it doesn't help us getting the best result for you. So take care of those active infections when you can. Worst case scenario, if you can't do that case now, any problematic tooth like that, get it taken care of immediately. Okay. Hopefully this information was helpful. Give us a follow on our Instagram at North Texas Dental Surgery, also Facebook at North Texas Dental Surgery. Come check out our site. If you guys have any questions, please feel free to leave a comment below. Thanks.